All right, everybody, we want to welcome Andreas and Yvonne from the Kind Clinic. They're here to tell us all about the Kind Clinic. The floor is all y'all's.
Thank you so much. Thank you for everybody that's attending today. We're really excited to come and present about our clinic. First of all, my name is Yvonne and Andreas. I'm the Kind Clinic Administrator. And
my name is Andres Cordero. I'm the Supervisor for Patient Advocacy.
So, as everybody knows, we're the new kids on the block, if you want to call us that. We're part of an agency that's called the Texas Health Action. Texas Health Action, the main hub is in Austin, Texas. And as some of y'all may know, we have 2 clinics right now in Austin. And they felt like there was a need here in San Antonio, so they decided to open the clinic. And we opened a year ago, March 23rd, which was, if y'all remember, literally 1 week right before the lockdown occurred. So we had the grand opening, and we were gonna have a big old hoopla grand opening, and everything got stopped. So we're still blessed in that we have obviously filled a need here in San Antonio, and we have plenty of patients. We're right now about 700 patients. So most people ask us, what is Kind Clinic? So Kind Clinic, we're a little bit different than other clinics in the sense that we are not a Ryan White clinic. So we do not get funding through Ryan White, clarify that. And we provide an array of services. One service we provide is what we call STI testing and treatment, sexually transmitted infection testing and treatment. We also provide PrEP, pre-exposure prophylaxis. And we're, right now, from what I understand, one of the only agencies doing PEP, post-exposure prophylaxis, which means if you feel you've been exposed to HIV within 72 hours, you can receive treatment and it will help to not seroconvert. And we provide that service. We're one of the few. What we have found, unfortunately, a lot of times with PEP, that some of the healthcare facilities are not doing it the way it's really supposed to be done. So we're having to kind of make sure that it's being done in the right way. The other service we provide is gender affirming care, that is transgender transitioning or gender transitioning male to female or female to male, or even individuals who identify as non-binary. So we're pretty open with the different types of patients we see. And of course, last but not least, we do provide HIV positive care. And like I said, we are not Ryan White funded, but our services are free of charge. We do not charge for the physical exam and for the labs, and we do the labs there at the clinic. Now, we do ask for your health insurance if you have it, because if you get prescribed a medication, we have to access that medication, because unfortunately we can't cover the medication. Or we access prescription assistance programs or different other resources that will help access the services or the prescriptions that you're needing or medication. Now with the STI meds, those are free.
You mentioned prescription assistance. What programs do y'all use for the prescription assistance?
So I'm going to hand that over to Andreas.
That's a good segue. So I'm a supervisor of the patient advocacy team, and basically Yvonne likes to call us sort of like caseworkers. Our role essentially is to make sure that our patients have access to their medications no matter what their situation. So in terms of patient access, for folks that are insured, our advocates will get them signed up on copay cards. We'll communicate all that information to the pharmacy, basically so patients just need to go and pick up their medication. For patients that are uninsured, we will enroll them in what are patient assistance programs. Basically, they're programs that will pay for medication. They're offered by the manufacturing companies based upon what the medication is. One of the largest providers is Gilead Sciences, but depending upon what the patient's medication is, if they're uninsured, the advocates essentially prepare all the medications, deal with the forms. basically we end up capturing the ID, which we'll send to the pharmacy. So again, the patient can just go to the pharmacy and pick up their medication. So we also access secondary patient assistance programs. There are organizations like the Patient Advocate Foundation. So in cases where we use up the funding there, we'll access that. And then at the clinic too, we have the what's called essentially a fund of last resort. So if we can't find assistance for our patients in other ways, we have something called the Kind Patient Assistance Program. And essentially any patient that meets the income requirements, the uninsured requirements, we can sign up to this program, and they essentially get a lot of medications either at no cost if they meet the income level, or the other option is they'll get essentially what I like to explain is as wholesale cost of medication. So a lot of our patients living with HIV may have other illnesses that they may be dealing with, chronic illnesses, for example. And so as long as our providers prescribe those medications and they need the assistance, we can sign them into the program, and they'll get it either much less expensively than they would at full cost, or even for free.
Yeah. And one of the things I want to kind of reiterate with Texas Health Action, there are other programs that we have. Kind Clinic is just one of the programs, and Kind Clinic being sexual health and wellness, we really focus on that, and prevention, and really being patient-centered. Another program we have is in Austin. Unfortunately, it's only in Austin right now. We provide outreach and testing, so we have outreach. And we also, only in Austin, hopefully they'll expand, we just recently acquired Waterloo Counseling, which with Austin, individuals who are living positive in Austin, they are one of the very well-known mental health counseling agencies that were providing counseling for special populations prior to merging with us. And the last new program we just started, because we did so well with COVID, with telehealth, we call it Telekind, with virtual appointments, we decided to open a program for that. And that program is targeted to rural areas in Texas. So like Laredo or Dehanes, or, you know, we get people who were driving. I mean, we had people who were driving from Lubbock and from all over coming to our clinic, you know, and that's a long drive. So we decided that we felt there was a need, and it's unique with our Telekind in that they can go online at www.mytelekind.org, right? It's .org, I think. Yeah, I think it's .org. If it's not, we'll make sure we get you the website, because it just launched not too long ago, and I don't want to give the wrong website. But the individual can go on, and then they can actually register online. And the provider does see the individual virtually, and then we either have them go to a local lab and get their labs drawn, or we have self lab kits that they actually get to do at home. So it's pretty innovative, and we're excited, and it's launched, it's been very receptive, and we feel like it's going to be something that THA, we call it ourselves THA, Texas Health Action, is really proud of, because one of our missions and our goal is for that sexual health and wellness and prevention, especially towards HIV and ending the epidemic, and making sure that we're reaching all individuals. And what we pride ourselves at Kind Clinic is we start at the beginning with sex education, because that's where it begins, right? And how do we keep ourselves healthy? How do we have that wellness? A lot of times we get patients who come in and they're like, how many times should I come in and get my STI testing? And we recommend it can be anywhere from every 3 months to every 6 months, depending on what your choices and preferences, like your lifestyle and your risk factors, what we call risk factors.
If you're having sex like every single day with 3 or 4 people, is it still recommended every 3 months?
No. So sometimes we have individuals like that are more frequent or identify as sex workers, then we're going to recommend them to come more frequently. And we're very receptive. We're non-judgmental. We're very much a non-judgmental environment. And when you come in, we really take the time to sit down and ask you those questions. Who are you having sex with? What are some of your practices? We really get into that, which is unique. Yeah.
Okay, you mentioned sex education, so obviously you do this mostly one-on-one, but do you also have group education classes?
So I love that you asked that question, because that is something we want to transition to, and we feel a need, and we have a beautiful conference room that hopefully in the community we can use. Because of COVID, it really has limited some of our visions that, you know, our supervisors and everybody at THA, we do envision that, to go out in the community and do those sex education classes, because nobody's doing it right now. Nobody is talking openly about it and really teaching individuals. Y'all would be surprised how many patients we come in that have questions for us and have never gotten the correct answer for. Like, you know, oh man, I could, like for instance, we had a young lady who came in one time and she said, I need to get tested. And my nurse was like, okay, so tell me what your practices are, who are your partners? And she's like, what do you mean, sex? And she goes, well, she went into detail, you know, penetration, and I'm just gonna be frank because this is how we talk. And are you having oral sex? Are you, you know, asking all these questions? And this young lady said, well, I'm a virgin still, I'm not having sex. And so the nurse was like, okay, so why would you need an STI test? So she said, she's telling herself that, the nurse, saying, why would she need an STI? She goes, let's go back to, you know, let's start at the beginning. And that's where the education occurs. What does this mean? What does sex mean? What is, you know, what are the risk factors? What are the things I should be looking for? And this individual young lady was, I believe, 20 years old. So we're not talking 14, 15, we're talking 20. So everybody has different cultures, different backgrounds, different dynamics, where maybe that isn't something that's spoken at home, especially with our culture with Latinx, or however you identify, Hispanic or Chica. We like saying Chicano power, brown power. So however you identify, your culture is going to play a factor into it. So we look at all those things and how can we present it in a way that is comfortable. But that's what I like to pride ourselves, is that we are trauma informed, we're non-judgmental, and we meet the patient where they're at, and we're very patient-centered. Our new patient appointments, for the exception of new prep, are anywhere from 30 to 45 minutes, and our follow-ups are 30 minutes. So we're generous with our time, and you get that one-on-one with the provider.
You mentioned prep. I'm pretty sure that everybody who's watching knows what prep is, but explain what prep is for somebody that maybe doesn't know.
Sure. Actually, that question, so if you were to come into our clinic and you say, I want to get testing, we give you a little questionnaire card. And one of the questions is are you familiar with PrEP? Because it's an open conversation, right? And it helps the individual to get to learn, because anyone is eligible to receive PrEP. There are no special populations, everybody. That's how we preface it. So PrEP is a pill a day that prevents HIV. And there are different medications that you can take. It's a conversation you can have with your physician. There are some that fit other individuals that don't have a lot of side effects, and others that, you know, for whatever the convenience they like and prefer. There's just different regimens. It could be one pill, sometimes it is 2 pills, it just depends. And you would come in and get blood work done depending on what the doctor says, and it could be anywhere from 3 to 6 months to get your blood work done, just to make sure that the levels are well and that you're taking the medication and not having severe side effects. But that's basically what PrEP is. And Andreas, do you want to add anything else?
Yeah, so I worked at the clinics in Austin before I moved down here to help start the clinic. And a lot of our patients there, as I'm sure here, are younger individuals. They are just coming into learning who they are and who they're attracted to. And so a lot of our services are sex positive, as Yvonne mentioned, and also we work really hard to make sure that youth understand as well that we are there to care for them. So a lot of college age students, for example, come in and start asking about PrEP. And in that conversation with PrEP, we also start talking to them about STIs and basically sex positivity, the fact that we want them to be happy in their lives, that they enjoy their sexual lives, and that we're just there to support them, giving them the information they need, and encouraging them to make whatever decisions are most beneficial for them. So PrEP is how we started the Kind Clinic. It was actually a PrEP Access Project is what it was called. And it was all volunteer driven when it was first starting, from the providers to the medical assistants, the patient advocates. And so that's kind of where it grew. And at that point, then we started to look at offering other services, and that's how we added all the other programs.
I'm gonna add one thing that Andreas, he didn't say it today, but he's a pleasure advocate. And I'm gonna take activist, there you
Pleasure
go.
activist.
And I'm gonna say I'm a pleasure activist as well, because sex should be pleasurable and we should be able to enjoy it, whatever that looks like, or whoever it's with, or however many we have it with. I mean, it should be something that we should be okay with and not stigmatized, right? Because I tell people sex is just like any other body function we have, and it should be pleasurable, and also having the ability to have safe sex. And when we say safe sex, that's a broad term, right? And it means different things for different individuals. So that's where the conversation starts. What is safe sex to you, and who with, and all that kind of good stuff. Yeah.
So I'm not sure if this was spoken, but do you guys have like a specific population you focus on? Because I know that there's certain companies that are kind of like restricted because of grants and stuff.
We are lucky. We don't have Big Brother overseeing us. And although we do get some grant funding and we get donations, because we get funding through 340B, we're able to use money in innovative ways, and that's why our clinic is a little different. So the answer to your question is, do we target some populations? Yeah, I mean, you know, as we know, men who are having sex with men, we do target for PrEP, because that's just how most people, but to be honest, what we've done different in San Antonio is, that's why I've been very open about STI testing, because I feel like it's foot traffic that I can start talking to people about PrEP, or we can't, not me personally, because I'm not in the rooms with y'all. My staff and everybody, our whole team, we feel like it's an opportunity to say, hey, have you heard about PrEP? So yes and no, in the sense that we want to expand to everybody, and we want everybody to be familiar, not only for themselves, but for their family members, for anyone connected, so we're informed, and so that someone can make an informed choice about how and what they're going to do in order to prevent the contraction of HIV. My previous clinic that I worked at, 23% of my population were women. And a lot of people don't know that statistic, and that pretty much goes with the national average, anywhere from 21 to 23%. So when people tell me, oh, women don't get that, women get HIV, you know, and a lot of times it's, you know, they're not even aware they have it. You know, as we know, 1 in 4 people don't even know they're positive. Since we've opened up, we have had about 12 new diagnoses in 1 year period. That's a lot. I mean, I don't know if y'all, in relative terms, that's a lot. Because normally at my previous job, we didn't really have that many new diagnoses. Age ranges they varied, but I will say they kind of leaned more towards young men. And we know from our previous experience when we, and I'm talking about when 2018, when the epidemiologist came and did our presentation on Cluster 51, we knew young Latino males were the ones that had the highest rate of positivity. And that's when we started End Stigma and HIV Alliance Group. So those are things that we know in our community, specific to San Antonio, that we needed to do something different. And we have to work together. We have to collaborate. We have to think outside the box, because whatever was working before is not gonna be the solution. So that's part of the reason why I'm proud to say I'm part of Kind Clinic, because they're willing to think outside the box. They're willing to push the envelope. You'll have to come to our clinic one day and you'll see the art, and the art alone will tell you we think outside the box. I've had people walk in and they're like, oh my God, it's a good conversation starter.
Just curious, because I've been to your clinic, is some of that art done by some of your clients, or is it from other sources? Because it is. Unique art.
Yeah, it is. It's like, no, unfortunately, the person they contracted, he did, well, I know a couple of the pieces are local artists, but not all of them. But yes, some of the pieces are from local artists, but not the clients, but from San Antonio. Yeah. But.
I know you're talking about, y'all kind of focus with HIV, but y'all also seem to do something else in that. Y'all work very well with trans. How does that work if somebody's going trans? How would they come?
Yeah, I'm gonna let Andreas talk about that.
Yeah, so if you're not familiar, essentially it's very difficult for our trans brothers and sisters, non-binary folks, to get access to care, and they've obviously made to be feel unwelcome, I think, in a lot of healthcare organizations and communities. So we essentially have created a program which we call Gender Affirming Care. And it's very holistic in the sense that a lot of times when you hear about trans or non-binary care for these folks, the idea is that it includes HRT or hormone replacement therapy, and yes, that is a fundamental component from a clinical perspective. But we also look at it from a very more holistic way, in the sense that we really focus on trying to provide wraparound care, in the sense that the patient may want to seek resources in the community. They may be seeking mental health support. They may be seeking just a variety of different services. So we do provide HRT if that is one component of their care that they wish to pursue. But we also focus on other aspects that they want. A lot of times they may need specific support that, again, wasn't available to them with other providers. So it's a very critical part, I think, of Kind Clinic in a lot of ways. And we are always out there trying to connect with the community and letting them know that they're most welcome. And not only that we want them to feel comfortable, but we want them to celebrate who they are. We did a video.
We did
for
Transpower, SA Transpower.
And I think one of the most interesting lines that was given in that video by a member of the community is that essentially, like, everyone's welcome, and your whole role is to be who you are. And so we provide as much support as we can for that population.
And I apologize, I didn't even tell you our proper pronoun. We didn't tell you our proper pronouns. My proper pronouns are she, her, and hers.
And mine are he, him, his, or they, them, theirs.
And we do also, Andreas didn't say, but with Gender Affirming Care, we also assist if someone is wanting to change their gender marker. We have some resources that we're able to help and support the patient if that's something they want to do. Now, with Gender Affirming Care, we do provide as young as 16 years of age. If it's anybody younger than 16, then there are some couple of steps that they have to do. Really, 14 is the cutoff, but if you're younger than 16, we ask you to do a couple of things, like get a pediatric endocrinologist consult, because there are some things that medical-wise require us to get clearance before we can start. So 16 is really the cutoff age, and we just ask for the guardian to come for their first appointment. But once that informed consent is signed and everything, the guardian or the parent does not have to attend the appointments for follow-ups, which is nice.
I I do have a question from the chat, I think that maybe you can answer.
Sure.
Someone was asking about how many clients are gay women.
Gay women. So we're talking women who are, they're legal sex women or?
Yes,
Okay.
cisgender women who.
Cisgender women, okay. So, we actually have been doing a lot of women, and that sounded kind of weird, doing a lot of women. So, anyway, because we do STI testing and treatment, we've been having a lot of women who've been coming in. As a matter of fact, I ran the numbers from January up until now. We have seen 558 new women patients just for STI testing and treatment. So that is obviously a niche that we're reaching in the community because we're noticing there aren't resources. Because I was like, why are we getting so many women? And we couldn't figure it out. So we're looking to maybe possibly that be another avenue. We haven't, it's something we're discussing, but we do have some women who are on PrEP. I don't have the numbers for how many we have on PrEP, but we do have women who are cisgender women who are on PrEP.
I think this is a good also point too. We discussed, or Yvonne mentioned, that we meet patients where they are, and so in a lot of ways, I think you asked the question about what are the populations that we target, and we basically welcome everyone. One of the populations that we work with and have been working with more is, for example, victims of sexual assault, and so often. We have been working with the San Antonio
Rape Crisis Center. We have an MOU with them.
And so a lot of times they will send us some of their clients that need to go through the process essentially of getting tested. And we provide support, again, in a trauma-informed way. So that would be one population. But as an advocate, I've spoken to heterosexual Latino men, for example, Spanish speakers. I've spoken to Latino women also that are heterosexual, sex workers, what Yvonne mentioned earlier, people that are in the polyamorous swinger community. So there's just a wide variety of folks. And it's interesting because I think a lot of people see our clinic, and yes, we do are very active in the LGBTQ spectrum of the community, but often we'll have folks that don't necessarily identify inside of that spectrum that are coming in. I've had some really interesting conversations with folks. A lot of folks that are in kink, for example, will come in and ask about safer sex practices as it relates to exploring themselves in that realm. So it's fascinating work, and it's really cool, and it feels really good to help people essentially to learn to be comfortable with themselves and to just enjoy themselves. And the other part is the informed consent component, which is we like to see ourselves as not being the place where you come in and we tell you what to do. We ask you what it is that you're seeking. We provide you with all the information, and you make all your choices. You decide what care you want. As long as you sign the documents or whatever, we're there to support you with all that. So it's a little different model, I think.
It is.
I remember being tested back in the 90s and going into the STI clinic back then in Austin, and it was, essentially what I consider the traditional model, which is, I was given a handful of condoms, I was given the HIV test, I was told, what not to do, and we're a little different. So it's like we're not going to tell people what not to do, we're just going to inform them of how to lessen their potential exposure, for example, to STIs, to HIV, and little steps, right? So people can't make huge monumental steps, but if we help them along the way in making their choices, they start to, a lot of them start to kind of make different choices that are healthier for them.
And I think I love that Andreas said sex positivity. That's the platform we come from, because sex should not be a bad word, should not be something stigmatized, and everybody should be informed and know what and where and who and what our options are. we all have that right.
Excuse me for one second, I'm gonna turn your microphone more to Andreas,
Yeah,
because
sure.
people are having a little hard time hearing him.
Okay.
We're picking you up great.
I'm loud. I don't need no microphone.
I do have another question. I know that PEP can be a very confusing and chaotic experience. How do you guys like walk clients through that whole process of getting PEP?
Okay, what was that again? I didn't hear you.
PEP.
Oh, okay.
So he was asking, like, PEP was a very confusing, sometimes stressful. I think stressful is probably the word.
Yes.
Process for individuals, especially if they think they've been exposed. And so you were asking what our process is. So like Andreas said, we do have an MOU with San Antonio Rape Crisis Center, and so they refer some patients to us, and we do get patients who are on PEP, who get on PEP from that avenue. We also get individuals who call and say, I hooked up with somebody this weekend, I didn't really know their status, and I think I might, I don't know if I've been exposed to HIV. And we tell them, come in. So they come in, it is a face-to-face appointment. We do not do that appointment virtually because it is a sensitive appointment. When you come in, we do a rapid test on you, but unfortunately when you get exposed, sometimes the rapids are not accurate because of the time frame you've been exposed. So we do tell you that if you come in, and then we also do your other labs and do what we call the HIV confirmatory, and we do the STI test as well. An advocate sits with you, and I'll let you kind of.
Yeah, so the appointments are prioritized.
Yes.
So you don't have to call and schedule and wait. So for those of you that are not familiar, there's a 72-hour window from the point of the potential exposure to the point where we're unable to provide post-exposure treatment. At the same time that the patient is seeing the clinician and going through all the labs and everything, the advocates are processing all the paperwork. The goal is essentially that they will walk out either with their medication or the prescription has already been sent to the pharmacy, and there won't be any trouble in terms of being able to get access to the medication, because it's critical, right? It's like from the point that they're going to start the treatment, it's really important for them to start the medication. We do, the advocate and actually the whole team is kind of always paying attention to patients that are coming in that might be in a state where they're just afraid, or they're panicked, or they're worried. And so we have staff that will alert us. We have spaces that we can take them, for example, if they're not comfortable sitting in the main area. As an advocate, sometimes the patient may need counseling or may just need to kind of express their fear. And so we just create space for them. We let them process what they need to process and then give them what they need as they move forward. But I'm really happy that we've set up the process so that most of the time, I think all the time now, they walk out with a starter kit of medication. And it is very complicated because there are only certain medications that can be used for post-exposure. It has to be 28 days. And unfortunately, there are providers, emergency rooms, some urgent care clinics that don't know what the protocols are. And so they not only not provide the medication that they need to provide for the treatment, but it's also very expensive. And so they don't do anything to support the patient. So you could theoretically have a post-exposure patient that went to a hospital, is diagnosed, the provider doesn't know what they're doing, they get 3 or 4 Truvada pills and get billed $500 or $1,000, and then they go to the pharmacy and then they get hit up with another $600. Our process is set up so that the two things I tell patients always is be aware that you don't have to pay for anything here, and we're going to take care of you. Because those barriers, we're all familiar with them. Whether you are living with HIV, whether you are on PrEP, we all know the medications are just crazy expensive. And we try to do everything for the patients so that they don't have to worry about that. The only thing we want them to do is just take their pill. And we also encourage, or at least invite them, at the end of their 28-day process to consider PrEP as an option. A lot of patients won't do it, and that's cool. That's cool. We're just there to help them wherever they are.
Yeah, we don't pressure, and we do provide the follow-up appointments to the PEP. So you get started on PEP, and you do have a follow-up depending on what the provider recommends, and all that is covered and it's free of charge. But we do try to take that opportunity if it's appropriate, because sometimes it's not appropriate, to inquire if they are interested in the PrEP. But since we've opened in March, we've done 80 PEP visits. Yeah, so there's a need.
The other thing that's really cool about this is that it's an opportunity for education. So Yvonne was mentioning, unfortunately, in this state, like a lot of states, we don't have what I would call accurate sexual health education. And so a lot of folks don't necessarily understand what their potential exposure has been. So we go through those situations where they'll come in, they'll say, you know, I made out with someone, or, you know,
They bit me on the lip.
I've heard holding hands even. Unfortunately, that stigma is out there. That's an opportunity also, if they don't need post-exposure, to sit down with them and educate them on, hey, you know, this is the reality, and this is when you can increase the possibility of your exposure in your situation. You know, this is not only a situation where you weren't exposed, but you kind of have to take a look at the broader picture. So we sometimes have to step into the role, unfortunately, that a lot of our public education systems haven't provided to a lot of the citizens of Texas, to help them to understand more about STIs, HIV, all of that sort of thing. So it's really sad that stigma still is out there, and we're out there trying to make sure that people get it and they understand it, and again, they feel happy and you know, celebrate their sex, their sexual orientation, their identity, their expression.
We actually get people who come on a regular basis, which I find kind of odd, you know, because we'll recommend them. You'll get regular routine, we call it routine testing, and I'll see repeat patients come back. I'm ready for my testing, and I love it because that just tells you how committed they are in making sure that they are healthy and that they're getting the treatment they need. Because we all know there are some STIs out there that are sometimes life-threatening. Syphilis is one of them. You can go blind. You can get neurosyphilis, and we've seen patients that have progressed. And sometimes you have no symptoms and you have no idea you have syphilis. So there's just so many different things. But we do the full STI testing panel.
So we have a question. We'll jump in and interrupt.
Sure.
We have a question on that. Can you actually list what STIs you test for?
Sure. Let's see if I remember them, like the 7 dwarfs. There's gonorrhea, chlamydia, trichomonas, syphilis, bacterial vaginosis.
The HEPs.
The HEPs, we also test for hepatitis.
A, B, and C.
Mm-hmm. A, B, and C. Am I missing anything?
HPV?
HPV. HPV, I'm going to say a disclaimer. HPV is hard to test for because you have to be in an active outbreak, and it doesn't always come back positive. And so what we recommend is if you're having an active outbreak to come in, and we provide treatment for HPV.
Do you guys do the vaccine for the HPV?
Yes, we do. We do vaccines as well. That's another thing we have. We're part of Adult Safety Net, and so we have access to those vaccines.
Well, the other clarification point I can think of too is that occasionally we'll have patients that come in and they want to be tested for herpes, and what we basically what our practitioners let our patients know is that these days, pretty much, if you're sexually active, you know, it's just something that you probably have, and the tests are really difficult and expensive to administer. So that's one question I know that I've seen before, that it doesn't happen a lot, But I think that, I mean, I grew up in the 90s, and it's always like, oh, well, watch for the herpes kind of thing. And so it's certainly a concern, but I think that a lot of people don't understand that pretty much if you have had more than one partner in your life or whatever, chances are that you have it. And there are medications that can help to address any outbreak that does happen, and the providers can certainly look at.
Yeah, I mean, if you call us and you say, I think I have a lesion on my tongue, or I think I have, on your genitalia, you have something that's going on, we're gonna have you come in, and we'll test you, and we'll also the provider will do a actual eyes on and see what's going on.
Is there a cover for that?
What do you mean, like a charge?
Yeah.
No, everything is
That's
free.
covered?
Yeah.
Covered.
Well, I was like, what, I mean,
Yeah,
I'm
but you have
gonna
to
make
have
sure, understanding cover, what that means.
You have to have your hand stamped, right?
You have to have a smiley face. No, there are no charges whatsoever when
Okay,
you
what
come
if
in
you
there.
have insurance and your insurance doesn't cover it? Do you still take them?
We still take. The only time when we ask you if you have insurance when you walk in the clinic, and we go by your word. If you tell me you don't have insurance, we're not gonna interrogate you. And the reason why we ask for insurance is because of the medication part, but that's more for PrEP, gender affirming care, or PEP, or that's pretty much it. Or
Yeah.
HIV positive, because as you know, THMP or ADAP will not cover your meds if you have insurance. So we do ask for that, but for STI testing, for treatment, we do not ask for your insurance, and you're not charged because we're part of the Department of Dishes, and we have that type of program where we get those medications free, kind of like the Metropolitan Health Department. And when Metro Health charges, it's not because they're charging you for the medication, they're charging you for the administration, for the other stuff. And for us, we don't charge that. For the clinic visit, for the provider, for the MA that's helping you out and all that stuff, so.
If someone wants to go get tested and live across town, do you provide a pickup ride, I guess you wanna call it?
I'll let Andreas answer that question.
So we do provide support for patients that need transportation assistance. Basically, the patient needs to ask for that support, and we look at the situation. Most of the times, at the very least, we're able to provide bus passes for patients, but occasionally, for example, with a post-exposure situation where they need to get in as soon as possible, or a patient is living with HIV that's starting care with us, we will provide support via Lyft. The only factor there is they have to live inside of the 1604 loop. Outside of that, we can't provide much support, but if they can get themselves inside of 1604, we can send a lift out to get them.
So we're pretty centrally located. You gave me a segue to say where we're at. We are located at 730 Isom Road, and if you've ever been on 410, we're right on the other side of North Star Mall. So San Pedro runs with 410, and we're right off of San Pedro on Isom Road. We're in between 410 and 281. So it's very much accessible through the bus route. There's literally a bus that drops you off right in front of the clinic, a stop right there. So you would be able to catch the bus. And if you call us and you tell us,
That's the 648 or 647?
it's one of those, yeah. And if you tell us I'm riding the bus, I may not make my appointment, and we'll work with you. We're not going to turn you away. I'm not going to tell you no. We'll work with you, and like Andreas said, the advocate will work on any barriers that's preventing you from being able to get in care. Right now, we are doing a majority of our appointments virtually. We're doing about 75% of our appointments virtually, but we're in the process of transitioning back into the clinic and doing face-to-face. But if a patient wants a virtual appointment, we're not going to say no. We're doing it still. We're going to honor that for as long as this COVID pandemic is. I am going to do a little blurb because I'm going to take advantage. We are doing an equity COVID vaccine clinic, and we're working in partnership with Walgreens. And we were gonna have that COVID equity vaccine clinic on May the 22nd, which is a Saturday, and we're gonna have it from 10 a.m. to 2 p.m. And we are gonna have the Johnson & Johnson one shot available. One shot and done, what I say. And we're gonna have drinks, snacks, foods. We'll have also testing, STI testing available as well on site. So I just want to do that little blurb.
I wanted to put a couple of clarification points or finer points on the insurance. Technically, the only reason we ask you for your insurance is so that when we send your prescription to your pharmacy, it goes along with that. The other important thing to know is that if you are insured and don't tell us, and we try to enroll you in a patient assistance program, they can detect it. So if that happens, then we will hop over and get you a copay card. The third thing is in relation to confidentiality. I think this is kind of important too. We have patients, I mentioned earlier, that maybe are closeted or maybe they don't want their partner to know that something happened or what have you. We can, in situations of confidentiality, we can access the Kind Patient Assistance Program. So even if you are insured, we can, in a lot of instances, get the medication and get it paid for you through that program, and it doesn't run through your insurance. So that's kind of unique and different. Again, a lot of college students are just like, yeah, I got insurance, but I want mom and dad to know that I'm sexually active or whatever. And so we use that fund to help them out.
You mentioned vaccines earlier. Obviously, you mentioned that you're working in conjunction with somebody else on the COVID vaccine. What other vaccines can y'all offer?
We do the hepatitis series. We are doing, I think we have, oh my gosh, I'm going blank. With the adult safety net, I believe it's shingles. What are the other ones that they recommend when you get a certain age? The pneumonia, the pneumovax. Thank you, the pneumovax. And we even have the meningitis vaccine as well. I think that's all of them. I'm probably, what's twin vax? Can't remember.
That's
I know
beyond my area.
I know the terms.
I just handle the paperwork.
Yeah, I know, right? I know the terms. We let's just put it to you this way. If you're HIV positive or you're an adult, we have the recommended vaccines that the government recommends. They care, because we get that through the feds, the adult safety net program, so those are free as well.
I actually want to thank you for saying about the whole PrEP process, because I had a friend who needed to get on PrEP, and he went to a hospital and they did exactly what you said. They charged him an arm and a leg, and he was working, but so they used his insurance, but he still had to pay a lot, and he only got a couple of pills. So it's really good to hear that how the process actually works.
You told us where you're at. Can you also give us your phone number and your hours?
Yes, thank you. Yes, if you need to make an appointment, there are two ways you can make an appointment. You can call us, and I do recommend calling, because right now we are limiting some of the COVID, and because it's not face-to-face. Our toll-free number is 1-833-937-5463. And you can call, we will get with you. You may not speak to a live person, I'm putting a disclaimer out there, but if you leave a message, we get back with you right away. The second, you can go to our website, www.kindclinic.org, and if you want to start PrEP, you can definitely schedule new PrEP appointments online and some PrEP follow-ups and some of the other appointments. And we have a list of what our array of services are online as well at that website. Our hours are Monday, Tuesday, Thursday, and Friday. We open at 9 a.m. We close at noon, and then we open back up at 1 p.m. and close at 5. And we do it.
Close completely on Wednesday? Is that?
No, on Wednesday we have a late appointment day, and we open at 11 a.m. and we close at 3 p.m. for lunch, and we reopen at 4 and we close at 7 p.m. So that gives opportunity for access and you're able to come in. I don't want to advertise this. We do some drop-in testing, but I'm gonna tell you that that is contingent on what the volume is that day. If we're having a heavy day, you may have a long wait, and I'd hate for you to sit and wait for an hour to get just testing. You can call and make an appointment, and that way you know you're gonna get seen at 1 o'clock, and you'll be in and out probably within 20 minutes. That's how quick it is. We're pretty quick with our STI testing. So now if you come in and you're symptomatic and you say, I'm having these kind of symptoms, whatever it may be, you're not going to get out in 20 minutes because we're probably going to treat you right then and there, what we call presumptive treatment.
Do you do curbside testing?
No, we're not doing that right now. I'm hoping we get enough volume that we can convince our agency to develop an outreach program out here, but we'll see how it goes. We'll see.
Well, if there are no other questions, I want to thank you, Yvonne and Andreas,
Thank you.
very much for coming and sharing with us today. I was expecting 30 or 40 minutes. We've been almost an hour.
Oh, I'm so sorry, but it's...
No. That's great. That's wonderful. You don't have to fill in. There's lots of very good information. And I'm going to say this. I actually am very impressed with Connie Clinic,
Oh, thank you.
the services you all provide.
Thank you.
So I guess we're going to have, what's his name? Leo. Come up. And again, thank you very much for coming.
Bye, everybody.
Thank you.
Yes, thank you. Thank you so much. And I'm going to welcome anybody that if they want to come by the clinic and just want to take a peek, I don't mind. I'll show you guys, the clinic, and we're kind of limited though on how many we can have in the clinic. So if 10 people come, we probably won't be able to do it. But if you are in the neighborhood and you just want to take a peek, you're welcome to, come by. Thank you.
Thank you.
All right, so another round of applause for the Kind Clinic. Thank you guys so much for coming out here. We really appreciate all the information that you shared with us. It's an up and coming, wonderful clinic that I've heard so much about. So I'm really glad that you guys actually came down to be able to talk about in more detail what you guys do. So a few things that I do want to bring up. In terms of Living Positive news, we are accepting donations for clothing. If any of you guys want to donate any clothing, you are more than welcome to come into our office. We are also accepting socks and underwear. Make sure that those socks and underwear are new. We are also accepting hygiene products, so like deodorant, shampoo, toothpaste, toothbrushes, and just make sure that they're new as well. And then on May 22nd, Living Positive is going to be a part of a yard sale here at Woodlawn Point. I believe it's also from 10 to 2, which kind of sucks. But if you guys want to donate anything to that as well, so that way we could sell it at the yard sale, that would be great. We do have our quilts project that is still up and running. For those of you that are interested in getting a quilt, it is $15 for a square. And you can Cash App us the $15 at our Cash App, which is LPSA05042021 with the $sign in the front. And we're going to be doing that up until August, I believe.
Yeah, I think so. And there are actually right now there are 12 squares left.
Okay, so we have 12 squares left, and so if anybody's interested, you can always private message anybody on the board, Mark, Jace, John, Martinez, Wayne, and me, Sylvia, Santiago, and Jerry, if anybody wants to message Jerry. And then if we do run out of those 12 quilts pieces, don't worry, we are planning to do another one as well. As many as people want to buy. So, bye.
I'll point out that if you don't know somebody that you want to get a pound for.
Do you just want to talk?
No, I'm just going to say that somebody can donate $15 for somebody else who they want to. get it
Yeah.
down to cancer.
Yeah. And yeah, for anybody that doesn't know someone who's passed away while living with or affected by HIV, you can always donate a square to somebody that may need it. I know that we have a lot of organizations within San Antonio that maybe would like a donation. Let's see, our office hours, we are open from Monday through Saturday from 10 a.m. to 5 p.m. You guys are more than welcome to come on by. Our address is 702 Woodlawn Point, Suite 201A. Sorry.
Donaldson Avenue.
Oh yeah, 702 Donaldson Avenue. Sorry. 201A is our suite number, and the zip code is 78201. Our phone number is 210-218-9161, and we are available at any time throughout those hours. If you do leave us a voice message, of course, Mark or I or Jace will get back to you as quickly as possible. I also do want to remind you guys that we do have our podcast that we will be releasing weekly episodes on, again, called Living Positive Unfiltered. So you can find that anywhere. You can find podcasts like Spotify, Apple Music, Spreaker, Amazon, and I forget the other ones. But if you listen to podcasts, you'll know where to find them. And then they'll be coming out every Sunday from now on. And you can also reach us at our other social media outlets, so like Instagram, well, obviously on Facebook. We have a Twitter as well that you are more than welcome to follow. We'll have someone update that frequently soon, so that way you can be up in the know about Living Positive for those that are chismosos. But thank you guys for watching, and thanks again, Kind Clinic, for coming out. We love you guys, and we'll see you all next week.